Welcome all. My name is Anne Single. I'm the Chief Executive Officer of Patient Voice Initiative, and it's my pleasure to welcome you to this webinar. I join you today from Brisbane, Australia. That's the lands of the Yagara and the Turrbal, and so I pay my respects to their elders, past, present, and emerging, and also to any First Nations peoples and elders joining us online today. To get started, we're going to hear first from the President of Patient Voice Initiative, Sarah McGorham.
Hi, everyone.
Apologies.
Hi, everyone, and welcome to the Patient Voice Initiative webinar that we have scheduled today. My name is Sarah McGorham. I'm the President of Patient Voice Initiative. Unfortunately, I was hoping to attend this webinar, but my health has got different plans and has completely disrupted my schedule, so I won't be able to attend. But I'm really grateful for everyone who are tuning in. It's a really important conversation. We'll be talking about patient authorship and talking about what it means, what good looks like, and how we can move from patients being written about to patients helping shape the work itself. So a really interesting and important conversation. I'm really grateful to Anne Single for leading this conversation and especially our incredible panel, Stella, Karen, and Ashley. We're fortunate to have your expertise, your incredible expertise, and also juggling the time zones to sync up and join us for this webinar. So thank you very much for sharing your insights, and also thank you to everyone in the Patient Voice community for joining in and for all of us learning together on such an important topic.
Oh, and thank you to Sarah. We really look forward to seeing Sarah on better days soon. So for those of you who don't know Patient Voice Initiative, we're a patient organisation, but we're committed to ensuring that patients are seen, heard and valued in decision making, especially health technology assessment. And that's the process that sits behind the PBS and Medicare. And so it decides what will be funded in our health system. And we do this by working with patient communities to make sure people are equipped with the know-how and the know-who. And we also advocate for processes that are better able to learn from patients. But today is slightly different, but very relevant to our community. It's about patient authorship. And we hope over this hour that regardless of whether you're a patient author, a potential patient author, or someone who works with patients, that with this absolutely amazing panel we've got assembled, that you will gain some new insights into this area and feel a bit more confident in this space. I'm just going to start by giving you a definition of a patient author. Now, because we have Karen Woolley online, I'm delighted to say that she has provided us with a number of resources, and this is one of them. So some of you will have received this earlier today, a list of resources and papers. Others of you will find we send it to you after the webinar. And if you're watching on the recording, look in the thread below because we're putting all these links down there. So this comes from a paper in 2022, and it sets out really useful criteria for defining what a patient author is. For those of you not watching the webinar, I'm going to read the definition out. So a patient author should meet all of the following criteria. A person who lives with or is affected by a disease or a condition. That is a broad definition of a patient that includes those with lived conditions or receiving health or social care, caregivers, family members, and members of patient advocacy groups and those who represent them. A person who provides unique and valuable input from the patient perspective to the publication. We often talk about patient knowledge here at Patient Voice Initiative. and a person who meets all the criteria required for authorship. And there's an example there. And we've also taken from that paper a definition of a patient author's publication, saying it's an article authored or co-authored by a patient and is published in a peer-reviewed journal. And we're going to talk a little bit later about what a peer-reviewed journal is. Excuse me, being a bit tongue-tied there. But to help us do that, as I said, we've got 3 experts with us. We've got Stella O'Brien, Karen Woolley, and Ashley Ng. And I'm going to introduce them just like that because they're going to tell you in a minute a little bit about their interest in this area. But before we get to know them, we want to get to know you a little better. So we've got a bit of a poll for you today. Now, I'm just going to ask Cecily to launch the poll. Oh, terrific. I can see it and everything. So our first question is, who's online with us today? Now, we've given you a series of identities there, and some of you may relate to a number of them. So select which one you would like to be recognized in our little poll. And because we realize sometimes you're a patient, you're also a researcher, or you're a patient, but you also work in industry. We have multiple identities. So you'll actually see that you can tick multiple identities because we don't like putting you in a box, and we might talk more about that later too. Oh, terrific. We could see with the registration that there was a really diverse group of people coming through. So welcome those who we've not seen online before. Excellent. So we've got a really strong patient representation, and really pleased to have carers, patient groups, researchers. Thank you so much for joining. We've got industry and government too. And not surprisingly, we're overwhelmed. Oh, I was going to say we're overwhelmingly from Australia, but we're not. We're overwhelmingly from Europe. So Stella, I think you're driving that in. So welcome. Welcome everyone in Europe. We're really pleased to have you online today. And of course, we're always thrilled to be reaching up into Asia and our local area there as well. I'm just going to scroll down a bit further. And the next question is, who's had experience of either being a patient author of a publication in a peer-reviewed medical or scientific journal, or working with patient authors on a publication in those journals? And I can see we've got a great mix there as well. And then the final question on that list is about how confident do you feel as about being a patient author. So 0 is like you're not confident at all. Absolutely fine. There's no wrong answers on our polls. And if you go up to 10, then you're super confident. Oh, that's great. We can see we've got one person who's super confident. So feel free to add thoughts in the chat as we go along, as well as questions, because some of you will have expertise to share in this area as well.
And okay. Are you able to describe some of the results? Because we can only see the grey box. Sorry.
That is a problem. Okay, I'm going to tell you about them then. Apologies for that. I'm going to say that if we look at confidence, we've got one person down at 0, we've got 4 people at a level of 2, and 5 people at 4. So a good representation of people there who are just here really starting out, I suggest, in this area, or perhaps have been doing it and finding some issues with it. And then for a level of 5, midway in confidence, we've got 4 people, and we've got 3 people at 6, 2 at 7, 7 at 8, none at 9, and 1 person in at 10. And I'm just going to look back over those other answers to give you a clue. We've got 11 people who have experience of being a patient author, and 19 who have experience of working with patients on publications. And we'll share that round. I'm not sure why it's not sharing. And to be honest, it's evening. Let's just get on and get to the good content. Okay, so I'm going to end that poll. Actually, it should be sharing now, unless you're still getting a black screen.
Yeah, we can see it now.
Oh,
like it's popped up for us. Yeah.
Excellent. Okay. Thanks for letting me know. I'm a little bit in the dark with my screens and I appreciate all the feedback. Okay. I'm going to get out of there now because I'm interested in talking to our panel. So the format today is going to be that we're going to have a bit of a conversation. We've got some experts online. You can put your questions in the chat box. And depending how we go, we'll bring those questions into the conversation or we'll answer them in the chat box. As I mentioned, we've got resources that we'll also throw in the chat box. But let's get started and let's start by getting to know our panel a bit better. Ashley, you're a familiar face to us, having served on our advisory committee in previous years. Can you share a little bit about where your interest in patient authorship comes from and how you became a patient author?
Thanks, Anne, and thanks for having me here. It's a topic very close to my heart because I think I started out as a diabetes advocate. Actually, I started out as someone living with diabetes who then fell into advocacy and then fell into research. And I think it was one of those things where I was getting frustrated that I wasn't being heard and people were just saying, you are just a consumer, you can't do anything beyond sharing your story. And I said, well, hold my beer, let's do it. And so I guess now that things have evolved, I've, earned my PhD. Some people may call me a lived experience academic, but I do understand it's a controversial term in some circles. I would like to say that my advocacy has intertwined with my career path. And so when I did my PhD, it was a co-design of a mobile health program to support young adults with diabetes during life transitions, purely because I didn't want anyone else to go through what I went through. When I was doing my PhD, I didn't know there was such a thing as co-design or consumer engagement or patient and public involvement. These are all terms that I've come to learn down the track as I've sort of gone through my research career. And now I see my role as really as the person to just bridge the gap between clinicians, researchers, and the community in terms of making sure there is a seat at the table for advocates and facilitating conversations between clinicians, researchers, and community so that everyone has that opportunity to have their voice heard. And so this has led to opportunities like being able to write editorials and commentaries, including with the BMJ and the Lancet Diabetes and Endocrinology, about the importance and the value of having lived experience voices in research and in publications and presentations and across different mediums and channels. So that science communication aspect of it. So that's sort of my little summary of why this topic is really close to my heart and important, and I'm excited to jump into the conversation. Thanks.
Oh, thanks, Ashley. And I think there'll be elements in that will resonate with other people on this call, but it's quite a journey, right? And Stella, people may know you. We know you really well, and we know you particularly as a lay member over at the English HTA body, NICE. But can you tell us a bit about how you come to patient authorship?
I've previously been an advocate in the disability space because I've been deaf since I was 2 years old. And I was heavily involved in the first design of the web content accessibility guidelines a long, long time ago, which took until 2016 to be implemented by the government in the UK. I was pretty burned out by that, but I still had all this advocacy energy, which I started putting into health and social care, because this had been a burning irritation for me ever since my earliest childhood. And I thought it's time for me to do something about this. So yes, I've been a lay member of an HTA committee for 7 years. I've also served on funding panels for the National Institute for Health and Care Research and Cancer Research UK. And I have roles at an advisory or strategic level for national committees and international projects, which is a tremendous privilege because of the sheer range of people that I meet. And I learn about so many extraordinary people, technologies, and research projects. But across my roles, my strongest takeaway is that we need people with lived experience to shape everything about healthcare and research, from shaping the research questions to the design of clinical research how to get something through an HTA process and beyond to implementation in your local healthcare system. Because as the public, patients or carers or consumers, whatever you call us, we can only make meaningful decisions about our lives in healthcare if the information we're given or we read is clear, accurate, and easy to understand. And above all, it has to be relevant to our lives and those of consumers, patients, carers, and everyone affected by healthcare within a nation and more widely. And that's one of my reasons for involvement in publications, because if you want studies funded, if you want to influence policy, these shifts happen when stories meet strategy and you connect people's lived experience with decision making, because it's people's stories that hold the power to transform society, government, health and social care systems. Publications are an integral part of that.
I love your stories meet strategies, particularly because those are words coming from experience, not a lofty ideal, even if some days it feels something we're trying to aim for. Stella, you're far too modest to mention it, but I'm just going to mention that last year Stella was received an honorary PhD. She actually already has a PhD, so she's sort of doctor, but she got an honorary PhD in recognition of her work in patient engagement, and it was incredibly well deserved, probably very hard. I don't think you ever knew you would receive that, but really, congratulations to you. I love that it was a recognition of you, but also recognition of this field. And so congratulations. I'm going to go now to Karen. When I first met Karen and heard about Karen, I was told she's a guru of patient authorship, and she absolutely is in my mind. So not only is she a professor at two universities and committed a huge amount of years and study to this area, it's not just academic for Karen. It comes from a very personal space. Karen, tell us about how you got interested in patient authorship.
Well, thanks, Anne. I feel like we've got quite a few gurus showing their faces here today and also in the audience. So thank you, everybody, for attending. I did have to look up the etymology of guru, Anne, when I sort of heard this, and it means a dispeller of darkness. And I'd like to think that all of us, through our interest on this webinar, are going to dispel the darkness of ignorance. And that's really when you've been ignoring the patient perspective in the peer-reviewed medical literature. I think for more than 350 years, medical journals have largely ignored the patient voice. And that's to the detriment of everybody in healthcare, to pick up what Stella was saying. Now, because I am a bit of a nerdy scientist, I did do a few slides. So if you forgive me for throwing a few slides in when I'm talking. This first one, I think, is the good news slide, where we can really see, if you look at that green line on the left side of the slide, that's basically the number of patient-authored publications, and they're absolutely booming. Each year since the last sort of 5 years, it's just been an exponential increase. So, you know, the word is out, so keep doing what you're doing. For the bad news, though, when we look at the number of patient-authored publications in the whole realm of the peer-reviewed literature, it's minuscule. It's 0.002%. So if you think of a stadium with 50,000 seats in it, and each one of those seats is a peer-reviewed publication, one seat out of those 50,000 would be a patient-authored publication. So the voice is a rarity, and we have to change that. But and going back to how did I come to this, I can remember it clear as day. I was in a boardroom in New York City, and I was there with some really impressive leaders of clinical research. And I think I had the audacity to say, as we were looking at planning studies and planning publications, that we should involve patients. And not only should they be involved early with the study design, but they should be authors. And yeah, I was laughed at. And, with my experience as a carer, a bereaved parent, clinical trial participant, as well as funding research, doing the research, serving on government hospital boards, and as a medical publication professional, I knew that patients could make a unique and valuable contribution to the peer-reviewed literature. But I was laughed at, and those doctors and scientists told me in no uncertain terms that peer-reviewed publications were For clinicians and scientists, it was serious, and patients had no role. Well, they're not laughing now as patient authorship has increased. And I hope people on the call have really seen the patient involvement in health technology assessment textbook, as we spoke about last week, because it's incredible to see the number of patient authors in that textbook, 75% of the chapters. So we just need more evidence, and that's where my passion for this comes. I'm a big believer that evidence can counter critics. When you're standing in front of cheerleaders, it's easy to make progress. When you're standing in front of critics, it's a lot harder, and I find that evidence can cut through where that altruism doesn't.
Oh, Karen, hearing this and your story, I know we have a bit of a laugh about some of the reactions we get to our ideas, but I actually just want to acknowledge you all as speakers, and there'll be others online, for those times that you've pushed yourself out there to speak up for the knowledge of patients, to speak up for their perspectives, because it does take courage, and it's not always easy, and we laugh about it. Some of our reactions doesn't mean that there isn't a bit of pain associated with that, but we're really pleased to have the courageous people who have kept pushing this, because we're going to talk about what we might be missing if we hadn't gone this way. But Karen, can you help us from the start? Some people may not be familiar with what a peer-reviewed journal is, why it's different from other sorts of texts. Can you help us understand what a peer-reviewed journal is?
Yeah, and at the outset, and I really want to stress that I think there's all different types of communication, and people on this call have probably been involved with that, and we've seen from the poll results, we have a great spread of experience in patient authorship. So when patients are sharing their insights and lived experience through blogs and newsletters and videos and podcasts, there is room for that, and we need that because everyone learns in different ways. But we really, really need the patient perspective in peer-reviewed publications, because this is the literature that really does have great influence among policymakers who approve our medicines and health technologies, those who reimburse it, those who prescribe it, and more and more patients who can access the medical literature, and we have evidence showing that's the case. It influences their decisions that they're making with their healthcare team. So we just must dispel the darkness of not having a patient voice in the peer-reviewed literature. But I think it's really important, particularly when you're engaging in this new type of communication, that you're very aware that it is different when you're an author of a peer-reviewed publication. You must meet 4 very strict authorship criteria. And if you don't, you're going to border into unethical practices. And that may be completely inadvertent, but you need to know that there are strict authorship criteria, and your work will be scrutinized by peer reviewers. So these are going to be experts in the field, and I'm really heartened to know, and we've got Stella and Ashley, that more journals are having patient peer reviewers, those with lived experience, to really see, how relevant is this research. Your work will be scrutinized if it goes in a peer-reviewed journal. Now, peer-reviewed systems are not perfect, and you can look online, look up peer reviewer 2, and there's all memes out there. So it's not a perfect system, but it really is the best one we have at the moment to build trust and credibility in our publications. Other forms of communication may be faster, and they may reach a broader audience. So again, there's different types of communication, but peer-reviewed publications will undergo rigorous checks, and that's why they've gained the influence that they have. Now, patient authorship is quite new, and you've seen it increase from that first graph I showed. But what we all hope, and by doing events like this, is that we need to normalize it. And in a paper that we published a few years ago on patient authorship, the last sentence, I believe, was, when patient authorship is normalized, having a patient author on the byline won't be a headline. One day this won't be special. And really that's what we've got to strive to get to. So there's room for all kinds of communication. If you're going to go into the peer-reviewed literature, and I encourage you to do so, just be aware of the rules around there. I'd hate to see patient authors just because they didn't know or nobody gave them training support, that they fell into these unethical practices.
Oh, thanks. That's really helpful, Karen. Ashley, can you give us a compelling reason for patient authorship? I know it's hard to just think it down to one, but can you give us one compelling reason for patient authorship?
One, to be scrutinized by reviewer two. I love that. I think for me, primarily, it's to role model and demonstrate leadership in terms of recognizing the expertise that people with experience bring to research and healthcare improvement. We often hear about how researchers and clinicians have to involve people from the community, people with experience, but having them as patient authors on their publications, co-presenting with them at presentations at conferences, it's a really great way to role model and showcase this is what true partnership is. This is what it looks like, and it can be done in multiple settings in different research areas and different types, that you can work effectively and very meaningfully with people with experience to get really great outcomes. So I think it's nice. It's not a nice to have. It should be an absolute necessity to recognize lived experience as equal expertise as you would the specialist that's on board with the research.
And Karen, what would you say?
Well, I mean, I agree with everything that Ashley just shared. And I think, my most simple way is to describe it is that, it's simply the right thing to do. And the more you spend time in this area and you think about it, you scratch your head that why are we talking about this in the, just the last, really, 5-10 years? It's crazy. There's the adage, in patient advocacy is, nothing about us without us. And for 350 years, the peer-reviewed literature has been everything about us without us. When I was working on a patient co-authored systematic review going back 5 years ago, one of my co-authors said, it's our story we're telling. Of course, we should be authors. And another patient author from Japan said, if you change the input, who's speaking, then you change the output to make it more relevant. So, I think that publications about patients should be with patients. From our research, again, why wouldn't you do it? Because the benefits, we're starting to see the evidence grow to support patient authorship. And our research shows that you can really enhance the trust, the relevance, and the reach of publications. So for patient authors working with non-patient authors, academics who might be nervous about this or wary, I'd encourage you to show them some of the evidence, because this might actually pique their interest that, oh, hang on, relevance, reach, let me hear more about that if patient authors are involved. So again, we've got evidence from research and others are also validating this, is that if you have patient authors, you're less likely to have your paper retracted for misconduct or mistake. You're more likely to have that publication address questions that are highly relevant to patients. You're also more likely to have those publications be made open access. I know when, publishing with patient groups, if we said to, the authorship team, someone's going to have to pay $50 to read this, it just wouldn't fly. So you need funding or a fee waiver to make sure that they're open access. And if you have patient authors, that's much, much more likely to happen. And the other thing, you're much, much more likely to have publications accompanied by a plain language summary. So not only have you made it easier for patients to access it, but you've also made it easier for patients to understand. Now, the more emerging evidence, and this I think we still need more research, is when we looked at patient-authored publications, they had higher attention scores, which can be quite important in academia, they're altmetrics, and also more downloads. So, the word is getting out there with patient authors. But while on this topic, and I do think for new patient authors, just to be aware of some of the things that can go on in peer review publishing. And there's another adage that applies here, and that's publish or perish. And if we just put up slide 3 there, we can see that patient authors might be compelled to publish because in their heart of hearts, they really want to help other patients, and they know publications affect patient care. They want to make sure that that information, the results, insights are published. For non-patient authors, there are other factors. Yes, they want to improve patient care. We believe that. We know that that's a key driver to go into healthcare. However, there's other factors. Grants can be affected by publishing, international travel, conferences, speaker invitation, all of those other factors. And it can be a bit of a shock to patient authors that, there can be other behaviors that enter into publishing, like, I'm not going to get the information out there quickly. I'm going to go to a really high impact journal, even if I know it's probably going to be rejected, and delay that information getting out there for 6-12 months. So I think it's just important for new patient authors to be aware of that.
Oh, thank you very much, Karen. And Stella, you might have thoughts about have we missed anything then? And then I've got another question I want to come to you with.
You definitely haven't missed anything, but I'm going to refer people to the excellent chapter in the HTA book on epistemic justice, because Karen has been absolutely describing that. It is what happens when you decide that a body of knowledge isn't worth the same respect as other types of knowledge. And for far too long, healthcare has been seriously flawed by the omission of the perspective of the people who are at the receiving end of it. And as Karen and Ashley have described so well, we do need to be involved in this because nobody has experience of it the way that we do. And when we consider research initiatives, today's research is tomorrow's care. What sort of care do we want? We want care that actually understands the experience of the patient and knows what's going to make a difference to us. If I can just support what Karen and Ashley both said there.
Oh, thank you very much for that. And I'll throw the link to the book with the chapter 2 is epistemic justice for those of you who are interested in it. And we had Roma Damanasca on our webinar last week. So if you want a quick introduction to that area, she gave us a fantastic one. So, Christella, what's it like being a patient author, and what gets in the way of some of these goals we were talking about?
It's massively frustrating and rewarding at the same time. Karen's alluded to the difficulty of publication fees. And that's a massive barrier for publishing independently or trying to publish with a group of other lived experience authors. I'm currently going through this with a group in the UK that's known as the Shared Commitment to Research, which is a lot of public partners from various organisations. And we're actually needing to pick the journal by who will allow us to have a reduced rate for publishing. Now, that's not going, valuable as this is, sometimes when you need to make an impact, you do need to go to a higher impact journal, and funding that is entirely contingent on the people for whom you're contributing a public perspective, because they may have no interest at all in supporting publications from their public members. They literally don't have a budget for that. And that's a substantial problem because there are many things we'd like to write about that we don't have the funding for. And I see this in patient organisations because, as you've said, Anne, patient organisations are critical to an HTA process that listens to all of the contributors. Now, we collect submissions and testimonies from people, but if we want them to contribute real-world evidence, which is something we're hearing about more and more, unfortunately, it does need to be published in a journal that we can incorporate into all of the analyses that are done in an HTA process. And that's infuriating, but it's still true. And patient organisations are realising the need to do that, and they are likewise looking around for the resources to enable them to do that, because they know if they can formally collect the experience of people who are living with the condition and it's published, that can affect parts of the HTA process known as the utility values and other things in the economic model, We can't do that without a formal publication, unfortunately, or until we come up with another method of quantifying patients' experience or consumers' experience in a way that can influence the model. So we might be in a transition period where real world evidence will be able to make that difference in the future, but not right now, which is why we need lived experience involved in publications.
Oh, thank you, Stella. And Ashley, does that is that familiar with your experience? What's your experience been?
It's it's interesting because funding is always an issue, and I think as researchers we are always gobsmacked at how much a publication costs to put out there, but how much work their journals make us do in the background of constantly reviewing papers and things. And yeah, we do see that massive downflow effect of if patient authors can only access a certain type of journal, or the impact isn't as high and people aren't able to access that, or it's hidden behind a paywall, then it just doesn't do it justice in terms of why we're actually doing this paper. And it's definitely a huge issue that I think journals need to sort of start taking leadership on. Oh, and you're on mute.
Sorry, Ashley. Thank you. You mentioned that you've also contributed commentaries to journals like the BMJ. Can you tell us a little bit about how the British Medical Journal is approaching this issue?
I think the BMJ is one of the leaders in terms of patient authorship. So they have from time to time editorials that are focused on patient authors, and highly encourage that as well, which is fantastic. And so apart from that, and having the space for patients to actually publish their own pieces of work in a very reputable journal, they have peer reviewers as well, who are patients, identify as patients. But also, in terms of researchers publishing in the BMJ, they require every publication to have a statement around patient and public involvement. So they really spotlight that in every paper. So when you submit the manuscript, they will check and see if you have a section within the methods to see how you have included what they refer to as patient and public involvement. And even if you don't have patients involved, you are required to sort of state why. So, rationalizing it. And it's not, this is something we've talked about in different research circles. It's not about demonizing that you haven't done patient and public involvement. It's just rationalizing why. And some researchers may not be at that stage of doing it yet. They may not have funding to do that. There's a myriad of reasons as to why they haven't included that. And it may be something that's down the pipeline and they haven't got the right training to do so. Because the thing we are also seeing is, particularly in Australia, where patient and public involvement is becoming mandatory for grant applications, is that when researchers do patient and public involvement poorly, it actually destroys and ruins the relationship that may have been built, or the trust with researchers as well. And then you have jaded people with experience who don't want to go back into that field. So it has to be done very carefully and quite considered as well. So I think with the BMJ, I was very lucky and had to have had the opportunity to be part of that lived experience collection. And so they do a fantastic effort in terms of normalizing patient and public involvement, or consumer and community involvement, all the terms that you want to call it, in research.
Oh, thank you, Ashley. And Karen, now I know I've got a question there for you, which I'll direct you to in a minute in the chat. But I've wanted to sneak in this one first. With your decades of work in ethical and effective involvement of patients in publications, can you help us to understand what good looks like and how we get there? Are there principles or guides? How do we do this?
Well, you know that I'd be lying if I said it was just easy, have a go, hold my beer, to quote Ashley. It's actually, look, I think it takes academics years to learn how to publish. It's not easy. It's going to take a fair amount of effort. So I think patient authors and those who they work with shouldn't expect perfection straight away. You will be learning. Everyone has to. Now, at the behest of some leading patient advocates in Europe, we were asked to prepare a training course for patient advocates, co-created with patient advocates, to help them transition from patient advocates to patient authors. And that's, again, another slide there, which I want to stress that this course is not just a writing course. There's lots of books on how to write a paper, some really good, YouTube, whatever, however you prefer to learn. But what we stressed was that there were ethical principles. And so module 1 is all about the ethics of how to write a paper. And it really goes back to the ethics of planning that paper. And then the ethics of following up, evaluating that paper. So there's 4 modules. Importantly, it's free. So we really wanted to remove any barrier. It's online with audio, or you can turn the audio off. You might have to listen to my accent. So if you prefer that, off. It's evidence-based. Wherever we could find evidence, we drew upon that. And, that co-creation also injected case studies and interactive exercises. We've actually studied the course and how it's been taken up, and it's absolutely meeting, all the goals that we set out for it. So, it's free. Have a look, and if it helps you, I hope it does. I think we now know, and we're starting to know more and more about what good looks like from studying patient authors and patient author publications. And just to highlight that, I've had the privilege of meeting with, a leader in this field who's sadly passed, was Tessa Richards from the BMJ, and then Emma Doble taking over, and meeting with them in London last year. The BMJ is doing great things there, and they are using patient author as an affiliation, which really allows us to start to find patient authored publications. When we do that, we now know that patients shouldn't be boxed in to say, oh, you're a patient author, oh, you can write a case study report. That's it. We know that patient authors are actually working across many therapeutic areas. They're doing all kinds of publications, so case reports, randomized clinical trial results, protocol publications, systematic reviews, HTA, health economic outcomes research papers. The patient authors can be involved throughout the number of article types there. Also, we're studying and finding that patient authors are involved in all stages of the publication life cycle. So that's planning the publication, writing the publication, sharing the publication, and then evaluating the impact of that publication. We can only do that because we have methods now to study, and I'm going to come back to that as my final point. One of the things that is a concern, though, and, Anne, you might look at the demographics of who's on this call, but our research has shown that whilst patient authors add diversity to the authorship table, when we're sitting around the table writing a paper, having patient voices really does bring diversity to that authorship group. It's not just clinicians, scientists, statisticians. However, when you look at those patient authors, what we have found is that the majority are not diverse at all. So they are typically women. The majority are women. The majority are older, middle-aged. The majority are from high-income countries, and the majority are from English-speaking countries. That's hardly representative of every patient group. And so we need to improve there. And just a bit of trivia as you troll through the research, and this isn't in the publications, to go back to Stephanie's question, most of those stats you'll find in the patient authorship evolution, revolution, or solution paper that we published. What we didn't put in was the most frequent name for patient authors is Maureen. So if we've got any Maureens on the call, go Maureen. I think good also means, and it's not bad. And so I'd encourage people, again, if you just want a quick read over a coffee, I published an article on LinkedIn recently about the 4 Gs of patient authorship. And I think, again, another slide on that. And that means that, these are the unethical practices that you might inadvertently fall into. And this message goes out to any non-patient authors, academic allies that might be out there. You don't want to jeopardize your patient author. So we can't have patient authors be guest authors. We can't have patient authors be ghost authors. We want to get away from patient authors feeling they have to be in guise, like that sort of imposter academic or an imposter patient. That's not who we are. We have to bring our whole selves. And whilst you might prioritize patient perspective, you can't ignore, you bring others. What we do want is patient authors to be guarantors. And in the peer-reviewed publications, you will often have a guarantor for that publication. A patient author guarantor is new, but what it means is you guarantee the journal editor, the peer reviewers, the readers, that a patient perspective has been included in that publication. It's highly visible because you've got patient author written there in the byline, and your contribution is substantial enough that it warranted authorship. So again, that's what good looks like. I think relevant to HTA and patient involvement, another slide there is really giving cheers for cheers, because there are major reporting guidelines now that are available to help authors know, what do I need to put in this publication? Like, have I reported everything that I'm supposed to? And most of them have about 25, 28 line items on a checklist. And you can get those reporting guidelines free from the Equator Network. Cheers in the health economics area is one of the first major reporting guidelines to require authors to report how they involve patients. So there's really this awareness raising that, hey, if you're writing a paper in this area, how have you involved patients and what difference did their input make? And I just finish off with something that's, it's sort of a methods issue, but everyone on this call can make such a big difference if you're aware of it. And what good looks like for a patient author publication is if you can find it. And these have been notoriously hard to find, and taking lots and lots of time and resources to do any research to find out more and learn from patient authors and their publications. There's a simple and free way that you can all help, and that is simply, when you have your name on the publication, you add in one of your affiliations, patient author, 2 words, patient author. You can have other affiliations, so do put in the patient advocacy group name. Do put in your university affiliation if you're on an advisory board or a hospital. But if you add the words patient author, then we can quickly find your paper through an online search. And it adds transparency and credibility right up front. Everyone can see it, rather than trying to go through the paper, if they can afford to get the paper, looking at your name on the internet. Oh yeah, I think they're a patient, but patient author is now being taken up by the BMJ. We called for it back in the first systematic review on patient authorship back in 2020. We called for this because we found out research was really hard. The BMJ is doing it. Leading publishers are doing it. The HTA textbook, beautiful to see, so many chapters, patient author, clear, visible. So I would really encourage everybody on this call, if you're involved, if you're working with patient authors, please put patient author as one of the affiliations. If you want to preserve and retain confidentiality, there are ways to do that and still have patient author on the affiliation.
Oh, thank you, Karen. I know we just asked you to crush a massive area down into just minutes, but I think there's all sorts of gems in there. And can I just say on behalf of the editors of that book, how grateful we were to be able to have your advice about how to manage patient authors. And 3/4 of the chapters of that book are patient authors. And when I say manage them, I just mean manage how we appropriately list them, not manage people. That's well beyond us. So Stella and Ashley, can I jump back to you, because I can see time's running away from us. And I really want to ask, we've covered so much here. Is there one thing that you would really like patients to take away based on your experience in this area? One piece of advice that you think would be really helpful to them?
Stella, you can go first.
I was waving at you because you had your microphone off.
Oh, I didn't even notice that. No, you can go first.
So, no, it's have the confidence to do this, because there are people out there who need to hear it, and there are processors that need to hear from you. And no change has ever been affected by you keeping your voice and your experience to yourself. Nothing is going to spontaneously change if you don't share what you know with other people in a way that they will respect and to which they can pay attention. At the moment, it is publishing in journals. There will be a time when that changes. That time is not now. But for now, you will not make changes if you don't turn your experiences and stories into a way of strategically leveraging that to make the difference that you want to see in healthcare and research.
Thank you, Stella. Well said. Ashley.
I think I'll then flip it and say for the researchers and the allies who are in the room with us today and listening to this, it's also your role to advocate for patient authorship. Things won't change if we are just complicit and sitting here and not letting anything change. It's up to us to say we're not paying this ridiculous fees for open source, open access, and to create the change. We need to be the change if we want to see the change happen. So it does take a collective to come together and get that to happen. So I'd say as an ally, it's also our responsibility as researchers, as patient advocates, to make this change together.
Oh, thank you, Ashley. And I'm going to just squeeze one more question in for Stella. Stella, sometimes, when you're a patient, you're also a researcher. And when you're a researcher, you're also a patient. And we're not solely in these boxes, as Karen alluded to. How do you manage that? And how can you help us understand how you position these multiple identities in authorship?
It's quite complex, and I don't know what other people's experience of this is. But I've certainly been in an authorial team where the fact that I had my own qualifications, my own professional life, and my own experience was effectively invisible to them. They didn't care because the fact that I was the patient author meant that I was there to be tolerated and I was a necessary part of the funding. I wasn't actually seen as a legitimate source of expertise or knowledge. Walk away from those people. You only have limited time and energy. Walk away. Work with people who treat you with parity of esteem, who recognize the value that your whole self brings to something. Because one of the experiences I really enjoyed about the HTA book was that my contribution was embedded throughout the chapter on medtech. It allowed me to bring in my professional experience, some of my lived experience, and my experience of being a public member of HTA processes and our regulator in the UK. That was bringing my whole self. I was listed as a patient author, but it's one of the few times it's leveraged a very broad range of my experience, and I thoroughly enjoyed that.
Oh, and we could see what it was bringing to that chapter. Terrific. I'm going to try and squeeze two questions in that are in the chat before we finish. So we've got one there from Deb, and she talks about being a patient reviewer for BMJ for some years and accepting some papers outside her condition in the beginning and enjoying giving input. But of course declined some way outside her experience. And when queried, oops, my screen's just moving, why none seem to fall under my stated expertise. They claim no papers fitting condition were ever received. I've not been invited since. It makes me wonder if review of trial design measures or disease paradoxes by a lay person scholar may not be welcome. Does anyone want to give a comment or thought there?
I think that's an excellent point because I often comment that the authors will frequently say, we don't do PPI within our country. And that's the full extent of it. And I think, well, had you actually consulted a public panel, you might have learned that you would have benefited from different patient-reported outcomes or a slightly bolder trial design. I don't know what other people's experience of that is.
Well, yeah, go Karen, please.
I think, our family has just had a recent issue with this, and we actually did a family authored publication. We're trying to find clinical trials designed with patients. So our family faced another devastating cancer diagnosis, and we knew that if you have patients involved in trial design, you get better outcome measures, you get faster recruitment, you get the trial finishing quicker, the trial costs less, there's less dropouts. It's seriously, why wouldn't you have patients involved? And there's evidence to support that, and we're pushing it. You turn as a patient and a family member to find those trials because that's the ones you want your loved one to go in. Not one single WHO registry around the world has a filter for patient involvement in trial design. So, we've just got to keep pushing. I've been speaking with the leadership of the WHO, see if we can get a simple filter in. Australia could take the lead here. Sorry to our European colleagues, but it's clinical trial registries are up and running. It's simply adding another filter, and it's devastating that we can't find those trials. That it's just nonsensical. So we need patients involved in trial design, but we've got so much more evidence now of the benefits of that. Why we don't let patients find them, I have no idea.
Oh, thank you, Karen. And wearing another hat, I've been really pleased to be working with Belbury, the Human Research Ethics Committee, and they have a consumer and community advisory panel that's giving very early advice from consumers with the health condition and with trial design. And my role is simply to chair the expertise of those people and the wealth of it that is there to shape trials. So I think we're hearing too throughout authorship. Authorship makes us think about that end product, that dissemination. But what I've really heard from our panelists is authorship is about the involvement of patients throughout the process. I also just touched on that word consumer there, and thank you, Ashley, for picking up that question, because of course in Australia we use the term consumer quite a bit. To you, Ashley.
Yes, sorry, I was going to say on the point before, there's also a role for advocacy organisations in terms of connecting researchers and community members together. Some advocacy organisations offer research grant funding. And so whether or not it's, down to a research institution that's administering it or the organisation, the advocacy organisation to support patient involvement in research design, research trials, clinical trial design, that, they do play a role as well. But yes, on the term of consumer versus lived experience versus patient, the terminology is highly variable depending on patient groups, depending on context, depending on personal preferences as well. And I think sometimes it's easier to not be too fixated on one particular aspect and almost go with the flow, but just understanding that there needs to be some flexibility there as well to raise the profile of that concept.
Yeah. Can I also say it's a highly sensitive area? All I would say is that we are trying to move towards using patient author in its broadest term, which would cover, patients, caregivers. And if you want to use consumer as another affiliation, please do so. Patient author is simply a tag, a meta tag that's used to help your paper be discovered. And I think that's probably a whole other webinar about terminology. I've been in this area and no one has been able to gain consensus yet. So I'm not going to hold my breath. I would just make a plea that if we want to study more about patient authors, learn from them and their publications, that's the only way we've got at the moment.
Thanks, Karen. And it pains me to draw our session to a close. I'm just going to ask really quickly a few things. There's a couple of questions there, which I think we've got to follow up on afterwards, and we will do that. Cecily, can we run that survey? I'm hoping doing it this way. You won't get a giant grey block on your screen. So apologies, everyone. Is that showing for everyone the survey there? Just wondering about how your level of confidence is at the moment. Eve, actually, we just overwhelmed you with all the information with you that you gave us in the last hour. We gave you in the last hour. Do feel free to drop us an email. We're really open to any response people want to give us because we love doing these webinars and we build on these discussions. So I can see now, got a few responses coming in. I'm just giving you a bit longer because I know sometimes some people have trouble seeing the actual survey on their screen. So they're coming in. I know I'm 1 minute over. Bear with me. Some of you will be in the middle of your working day in Europe and the UK. So thanks for staying with us that bit longer. Okay, I'm going to make myself end the poll, and we can share those results now. Cecily, can you tell me if that's sharing?
Mm-hmm.
Great, great. So I'm really pleased there's a few more up at that higher end, and that to me is worthwhile. But you will have your own experience of this webinar. Do drop us a line. We very genuinely value it because we have such a diverse group of people who join us that we actually often need to do things in a slightly different way for different groups. So do let us know how you found it. I am now going to just do a couple of thank yous that I need to do. Firstly, she says hesitating, I want to thank our sponsors. We're really appreciative of their generous support, but also the way they work with us and their commitment to the patient voice and patient involvement. I also just want to be a bit sneaky and show you this. Hopefully you're seeing a save the dates slide. We've got two webinars coming up in the next 2 months. One of them is going to be the takeaways from HTAI's annual meeting. At the end of HTAI's annual meeting, it's in Istanbul this year, we always do a session with patients about what the key things were that they heard at the meeting for those of you who aren't able to attend. And wow, didn't we roll out the letters and the words on this next title? On the 3rd of July, we're going to do an introduction to MGHTAC. What's that about? That's about assessing the value of medical devices and human tissue products in Australia. So we've never done one in that area again. Apologies for the title, but we wanted it to be easily recognisable to the people who've been asking us for one of those. And with that, can I thank all of you for attending? We really appreciate the incredible turnout this evening or at lunchtime, wherever you are. Can I thank Cecily, who is our wizard of administration and keeps everything so well organised. And when you email us, it'll be Cecily on the end organising those emails and getting the answers back to you. And then may I say a huge thank you to 3 women who just impressed me enormously. Karen Woolley, Stella O'Brien, and Ashley Noon, thank you so much for your expertise and your time today. You're very much in demand, and we really appreciated your time on this.